name Billy? Billy Sanchez?
It is.
Nice to meet you, Billy Sanchez. Can you confirm your date of birth for me?
April 13th, 1985.
Awesome. Well, my name is Hannah Jones, and I'm going to be your student physical therapist for today. How are you feeling today?
Weak.
A week?
But I feel okay. I'm kind of in a good amount of pain, not the worst, but yeah. This isn't my best day, but it's not my worst day.
Okay. Have you been having any further symptoms or any symptoms that have been getting more intense?
Not since a couple days ago.
Not since a couple days ago. Okay. Well, what I want to do with you today is I want to do a little bit of stretching so that way we can maintain the range of motion in your joints that you have, so that way whenever we're ready to get back up and doing activities, we'll have all of those, your body will be ready to do that, okay?
Sounds good. I haven't moved in a long time.
Well, that's what we want to get you to. We want to get you moving, okay? Because that's
Okay.
important. And then after that, we'll do some lung work, meaning that we're going to work out the muscles that help you breathe. And then we're also going to work on some positioning stuff, okay? Just so that way we can avoid pressure ulcers, because that wouldn't be a good thing, okay?
Sounds good.
Alrighty. So first what we're going to do is I'm going to help you get laying on your stomach. That's going to be, it's going to feel a little weird, but I'm going to help you get to that position, and this is going to help me get a really good stretch on your hip flexor muscles, okay? Those are the muscles that are right here on the front of your hip, okay? And then we're also just going to do some breathing stuff after that, okay?
Sounds good.
Alrighty. So first and foremost, can you show me the amount of motion that you have with your legs at all? Okay.
I got a little bit.
You got a little bit?
Not much.
I saw it at your knees.
I can do this.
Good.
Yeah.
Yeah, there you go. Okay, can you feel this right here?
Yeah.
Can you feel this right here?
No.
Okay. Can you feel right here?
Yeah.
Feel right here?
No.
Alright, I just wanted to get an idea. So, really quickly, I am going to go ahead. I'm going to get on that side of you to help roll you, okay?
Okay.
Alright, I'm going to bring this pillow with me. Alrighty. So what I'm going to do is I am going to bend this knee up for you, okay? And I'm also going to straighten this arm. Sound good?
Sounds good.
Alright, help me in any way you can. If you can't, that's alright. Arm up. Beautiful. Okay. I'm going to roll you at your hip and your shoulder, okay?
Okay.
Alright. Right here. Right here. Are you ready?
I'm ready.
3, 2, 1. Here we go. You're going to be able to rest on this pillow right here. There you go. Good. Good. How do you feel?
I feel okay.
You feel okay? We're a little uncomfortable here on this arm, huh?
And on my other hand.
And on your other hand here.
Yeah. I don't move that too well yet.
No, you're good. All right. So let me go ahead. I'm going to come over to the other side. Here we go. And I'm going to help get this shoulder out from under you, okay?
Okay.
All right. So right here. Watch your head. This on. There you go. Right there. This is just going underneath your head. Good. You feel okay?
Yeah.
All right. Good. So I'm going to go ahead. I'm going to place this pillow kind of as just a support back here. Okay. Perfect. Alrighty. So I know we're kind of at an angle here, but I'm going to adjust your legs, okay? So I'm going to
Okay.
kind of adjust your hips so that they're flatter, alright? Okay, so I'm going to be right here. I'm going to grab your hip. I'm going to grab this leg. There you go. Just like this, right here. As much as I can. Are you comfortable in this position?
Yeah.
Okay. Alright. So what we're going to do is I'm going to stretch. So already you're kind of in a stretch here, stretching the muscles right here, anterior to your hip, okay? So you're kind of already stretching them, but I'm going to bring this leg up a little more to stretch them, okay?
Okay.
And then I'll do the same to the other side, okay?
Okay.
All right. Really quickly, get an idea for your range. All right. So I'm just going to hold this at a stretch. We're going to hold that for about 30 seconds, okay?
Okay.
And really quickly, so while I'm here, I just want to let you know that you said you were in a lot of pain. Can you talk to me about that pain and what it feels like?
I mean, I have some pain in my knees and some neck pain. My neck pain is what started all of this, but right now it's kind of where they told me it's my peg.
Your peg.
Whatever that is.
That's your feeding tube that's in your tummy.
Okay, well, it hurts. And, yeah, it's all just, like, sore and sharp and annoying.
Okay. So, do you ever experience, like, any sort of kind of burning pain as well? Shooting and burning pains, kind of nervy feeling?
Yeah.
Okay. So, I just want to let you know that while your nerves are kind of, they're regrowing almost. You had some damage to the nerves. There's a nice little sheath of conductant. And so what I mean by conductant is that you know how some materials like metals will help things, it'll like take things through and it'll flow through, or if you surround things with like an insulator, it'll help the conduction of electricity.
Yeah.
So your nerves have an insulation called myelin. And so what's happened is that your immune system has accidentally targeted that myelin and started to kind of wear away at it, if that makes sense. And that's why all of these symptoms that you're having have occurred. And so what's happening now is that your body is kind of calming down. We're giving you a lot of immune therapies, so that way your immune system can kind of reset and your body can regrow that myelin on your nerves. And that way the signals will be able to transmit better in your nerves, okay? And so you're going to have some pain, though, as everything is regenerating. But I just want you to keep that in mind, all of those different processes, so that way you know what's going on. It's like, okay, I may be having pain with this, but as I keep moving my body, as I keep exercising, eating right, fueling my body correctly, it'll help that growth, and it'll make things feel better. So even if you're in pain, it's important to keep moving and to keep trying to be as active as you can and trying to make sure that you eat right for your body, okay?
Okay.
All right. So we have one more. That was 3, and then we're going to go to the other leg, okay?
Okay.
Good. Do you feel that stretch at all? Because I know you had some sensation up here, so do you feel the stretch?
Yeah.
You feel it? Is it too much pain or anything?
No, I think it's right where it needs to be.
Perfect. All right, beautiful. All right, and then we're going to go and we're going to treat the other side, okay?
Awesome.
All right, go ahead and set. Okay, so we are now going to roll you back into laying on your back, okay?
Okay.
So I'm going to set up these pillows for you. Alrighty. So what we're going to do is we are going to roll at the hip and the shoulder again, okay?
Okay.
Alright, so I'm going to be right here. I'm going to bring your arm down right here, right next to you. I'm going to grab right here. I'm going to go ahead and I'm just going to scoot. Scoot like that. Alright, are you ready?
I'm ready.
3, 2, 1, here we go. Here we go, here we go. Got you. Good. Beautiful. I'm going to help position your arm better because that doesn't look comfy at all. There you go. How does that feel? Okay?
Yeah.
Okay. I'm going to bring your shoulders up so that way we can get these pillows underneath you better, and I can also stick this third one. Okay?
Okay.
Alright, you ready?
I'll do what I can.
Alright, 3, 2, 1. I got you. Good. Sorry, I know we're hugging here. Does that feel good? Feel okay?
Yeah. That's good.
Alright, I'm going to just adjust this underneath your shoulders a little bit, okay?
Okay.
Alright. I want you to be in a good position for breathing. Alright, how do you feel?
I feel comfortable.
You feel comfy?
Yeah.
Good. Alright, so we are going to do some diaphragmatic breathing, okay? And what I mean by diaphragmatic is you have a muscle here called your diaphragm, and we want to use that muscle in your stomach to help make your lungs bigger to get in more air, okay?
Okay.
And so how we're going to practice that at first is we're going to practice sniffing, okay? So pretend like, what are your favorite smells?
Ooh.
I know you're a carpenter, so maybe like fresh lumber, or not lumber, lumber. That's a pizza joke. Fresh lumber.
Yeah, I'm also a landscaper. I really like the smell of roses.
Okay.
My wife smells like roses.
Okay, well then imagine the smell of roses and just take in 3 big sniffs for me, okay? So close your mouth and in through your nose. 3, 2, 1. Good. I'm going to place my hand right here on these 2 sides. Am I on your peg tube anywhere?
No.
Okay. I'm going to place my hands here. Breathe, like sniff and try to feel my hands, okay?
Yeah, I'll try. It's kind of hard.
You got it. There you go. Good. Do you feel my hands moving?
Yeah, I can feel that part.
Good. Good. Try to push that breath into my hands. Good. Deep breaths. And out your mouth. Let it out of your mouth, okay? So breathe in through the nose, sniff, and breathe out through the mouth. Good. One more time. Good. Let's rest for a minute. So this is going to help. You have what we call atelectasis, a little bit of atelectasis in your lungs. And that means that a portion of your lung has kind of begun to fall. Usually your lungs are really inflated, and there's a portion of your lung that has fallen, and it's in the lower portion of your lung. It's kind of started to fall, and that's not good, because we want your lungs to be big balloons, because we want it to hold as much air as possible. So I want you to do 10 more breaths with me, okay? And I'm just going to kind of cue you here, and we're going to try to open up those lungs a little bit more with this diaphragmatic breathing, okay?
Okay.
And then I'm going to give you this as one of your exercises to do when you're not with me as well, okay? All right, you ready? 10 more.
I'm breathing in through my nose again.
In through your nose, out through your mouth. What I'm going to do is I'm going to roll you onto your stomach, so that way you have another position in which it'll help open your lungs up. And then I'll have the nurses come back and roll you back towards your side in about 20 to 15 minutes.
Actually, is it okay if we don't put me on my stomach? When we were stretching, it felt fine until the end. My peg started to get a little bit uncomfortable, and I feel like 15 to 20 minutes might be too long.
All right, no, I totally understand. Could you potentially maintain like a position on your side without pain?
Yeah, I can do that.
Okay, then I'll position you on your side, and I'll have the nurses. I'll still have the nurses come and check on you in 15 to 20 minutes, and then if you're still okay, they'll come back again and rotate you to the other side in about 2 hours. Okay?
Okay, that sounds good.
Alrighty. Let me grab this pillow from under here.
Sorry, I don't mean to be difficult.
No, you're not difficult at all. I totally understand. Don't worry about it. That's what we're here for. Alrighty. So we're gonna do it just like last time. I'm gonna bring this arm straight up. Here. I'm going to bring this arm across. Good. And then I'm going to bend this leg up, and we're going to roll at the hip and shoulder, okay?
Okay.
Alrighty. 3, 2, 1. Here we go. Woohoo! Perfect. Alrighty. And I'm going to steal this pillow right here. Does your head feel good and supported?
Yeah.
Here, I'm going to get this. I'm going to go ahead and just lift your head slightly. Sorry about your hair.
It's okay.
Bring this over here.
Oh, that's
Hello.
nice.
That's nice. Good. And then I'm going to bring this. We're going to bring it underneath your leg here. Okay?
Wow.
There we go. Feel comfy?
Yeah.
Alrighty. And then I'm going to make sure this hand is nice and comfortable. And the nurses are going to come back and check on you in 2 hours, okay? Or actually 15 to 20 minutes to make sure your peg is okay. And then they'll flip you to the other side in about 2 hours, okay?
That sounds great. Thank you.
Thank you. Have a good day.